So the renal impairment in myeloma patients is still a treatment challenge. Those are sick patients. They have normally a high tumor burden, or they are hampered by severe comorbidities. However, the population is decreasing. We have less patients with renal impairment, showing that our treatment is improving, that prognosis is improving of our patients. The good news is that all the novel developments, the second generation proteasome inhibitors, the third generation immunomodulators like pomalidomide, and the monoclonal antibody strategies can be applied in renally impaired patients without any dose adaptation or dose reduction. It's key to treat those patients very early, very consequently, very intense, to lower the tumor burden in a rapid fashion, and then getting rid of the myeloma, and then getting the kidney back, the renal function back. And so many patients, fortunately, nowadays can recover. But it's crucial that those patients are treated in experienced hands, that the supportive care has to be much more in detail and increased in comparison to patients without renal impairment. So those patients really need a special care, and so they should be treated in experienced centers.